patients, do you ever feel that patients might think that maybe they are too weak or too old to start neurorehab? What would you advise to them?
Well, I think that when you have this goal to reach independence, it's never too late. What happens is that, as you just said, when patients just had their injury, um, their first goal is to walk many times, and they don't think, or we don't know, or the rest of the people that are not involved in healthcare think that the patient just doesn't is not has lost the ability to move by himself or herself. So but they don't know all about sphincters, autonomic control, etc., etc., etc. And so when they just had the injury, neurosurgeons or the doctor that first sees them will always say, you lost your ability to walk and you won't regain it. So that's the most important thing that comes to their mind in the beginning. So they lose a lot of precious time. It's the golden hour that I tell them always, all golden months, trying or expecting to come back and stepping. And that's not the most important thing. What we need to do is regain bowel and bladder, blood pressure, body temperature. Try not to have any other complications as pressure ulcers, pulmonary complications. So that's what we should work on at the beginning. Trying not to set the goal of walking, but setting other goals in the beginning.
Would you say neurorehabilitation is probably a treatment we can recommend for a patient for life, or is it something that can be done periodically?
I always tell the patients that two things, that neuro rehab becomes like a habit, as the same as brushing your teeth. You have to continue doing it all of your life. Neuro rehab is something that you should do. But also, we, as human beings, we always need some vacation or a break. So we can take breaks, we can take vacations, we can have a period of not doing all these kind of PTs, but always moving. If I'm not taking PT for 3 hours straight, what can I do? I can do some stretching for the day. I can do some standing for the day in a frame, for example. Or I can go swimming, or also I can start weightlifting. For example, if you like exercises, participating in marathons or any other sport that you like, kayak or something like that, paddle or something that you can do, or table tennis, also many patients. But doing something movement, some kind of movement. I remember a lot this PT from Australia, whose name is Natalia, and she always said that there's no static spinal cord injury in the world as long as you keep on moving all the time. So some patients always say with, okay, I'm a complete injury, there's nothing to do, or at least that is what they told me. No, spinal cord injuries, which are complete, sometimes can turn into incomplete injuries, even after 8 years. And we can see it in regenerative medicine sometimes.
Yes, we actually see this in our practice. So whenever a spinal cord injury patient comes to us, we do, especially when they come for one of our treatments, we always make sure to test their ASIA score, and we compare the results after some time. Dr. Beatriz, can you tell us about your experience? What kind of changes do you see, and maybe you can even explain a little bit about the scoring systems that we use and how patients tend to change over time?
Yeah, this impairment scale talks about two specific or two major areas: mobility or movement and sensibility. And they grade it. They grade it if you have it or you don't have it. And for strength, they do have a scale from 0 that you are not able to move or feel any contraction, muscle contraction, to 5 that you can do it against some kind of force or full force. And for sensibility, you either have it or not have it. And we have it the light touch or the pin prick, which is a little bit painful. So, and at the end, we do have the sacral segments that tell us if the injury is complete or incomplete.
Mm-hmm.
So we go to specific myotomes or dermatomes to find out what is the neurological level, and the level that is the lowest with the normal scores for both sides, both motor and sensible. That's the neurological level, when they converge. So this scale goes from complete to incomplete, which is scale A complete. E is the best score you could have, let's say it that way, and it's an incomplete injury. And you grade the level of the injury depending on the neurological level. Let's say cervical fourth, or thoracic level 7. With a complete injury, well, that would be thoracic 7 with A scale. So that would be
Mm-hmm.
a complete injury at level between the belly button and our chest. That will be. And that will preserve the function, the regular function of our motor and sensations above this level. And beneath that, that will be the the injury. So what we do with this scale, it's a scale with numbers, and it's also of quality. So we have been very fortunate. It comes to my mind one patient that we had here 12 days after his injury. He well, I don't. Sometimes I don't like to talk about this case because patients think that their case has to be like that case. But he came here at day 12 after his injury, and he gained from scale A to scale E in 35 days
Wow.
after regenerative medicine. Also, we had a patient 3 months after her injury, and she didn't get well, she was a scale A, but then she ended as scale D, as in duck, but she gained 9 levels. So it was great. And all of our patients with regenerative medicine in acute process always have regained the autonomic function of the sphincters, which is a way different kind of
Yes.
life.
Definitely, definitely. And could you tell us, since you're in the clinic with the patients every day, how do you see the emotional transformations in patients and also the families when they start to see the progress from ES, epidural stimulation, stem cell treatment, as well as the neurorehabilitation?
Yeah, one of the biggest things, as I told you before, that comes to the mind of the people a week after spinal cord injury is not only about uh, walking again, but about sphincters. Imagine, just try to picture right now being an adult and having to someone to help you with a diaper, or someone taking care of you having to pee or a bowel movement. So that really thrills patients and makes them be very sad and very depressed about that. So
Mm.
in the beginning, when they get to the clinic, we're using a Foley cath and having to take pills to have a bowel movement, or maybe suppositories, or trying to having to carry them or feed them with with a specific thing. uh, Patients get a different facial expression, and they really feel very thankful and very happy when all of a sudden it gets to the day that the urologist here at the clinic takes off the Foley cath and starts doing intermittent cath. What would this change come to them to bring them to their lives? Well, they can get into a pool as a recreative activity. They can have a sexual life. They won't have accidents. They won't have infections, UTIs, as often as they used to. And people won't see their calf. So that's very important to them. One of the biggest fears of people with neurological conditions is having this bravery to go to social places, restaurants, going to a party, going to the movies. So when we talk to them, when they get gathered together at the gym, it's very important how they start seeing that they're not the only person with this neurological condition in the world. So they start laughing again, um, maybe singing with the PTs, making jokes, and feeling happy about it. Not happy about their condition, but happy that they're doing something to get better each day.
Mhm. Okay, thank you, Dr. Beatriz. I just wanted to remind everyone that we are open for some questions that you can drop in the chat. We already collected some questions from our social media posts, but while we are waiting for everyone joining here to ask their questions, I wanted to talk about patients with spasticity and neuropathic pain who might be reluctant to start neurorehabilitation because of the fear of the pain or the spasms not allowing them to do it. How would you approach those cases?
Well, spasticity is present in all of the patients that have injuries. Well, in the central nervous system, that could be stroke, that could be multiple sclerosis, cerebral palsy, and of course, spinal cord injury, which are the most common or the most that we see here at the clinic. Neuropathic pain is not always present, but talking about spasticity, spasticity is not that bad for us. We want to still have some spasticity to help some movements for standing up and knee blocking. Sorry. And but if this spasticity is decreasing your quality of life, or it's limiting for you to doing the transfer, or it's painful also, we have different treatments. We can do PT, we can take some baclofen or some pills, we can use Botox in your muscles, which is an injection in the muscle. It's temporary and the effect lasts from 3 to 6 months, and then we can repeat. um, and for the neuropathic pain, we do have different things. First of all, we have obviously some meds that can help. We have some techniques also in PT, but we also have the ES. And when they do the epidural stimulation, mappers can program a specific channel to treat neurological pain. Mhm.
And talking about, let's say, if someone feels stuck and they want to start something, what can they really start doing at home even before they start a professional neurorehabilitation program?
Okay, moving, that's very, very important. We call it block moving. That is not moving like your hand or your shoulders or your elbows, but moving as a block and changing positions at least every 4 hours. So we don't have any other complications as pressure ulcers or maybe thrombosis. So what we would recommend would be moving, stretching, having a good sleep. We always need a good position in bed or in the wheelchair. Having a specific wheelchair is very, very important. Having good sleep and good nutrition.
Okay,
That's a
thank you
good
very
start.
much, Doctor. Thank you. I think this is really the basics, but it's very, very important to have this setup. I will now move to some of the questions we received. Um, we got a question. I am C5 complete spinal cord injury, 28 years old. Which treatment is best for me?
How long have they had the spinal cord injury?
We don't know.
Okay, that is very important to decide what we could help. Of course, we could help. That is a level that could be both for regenerative medicine as well as epidural stimulation. But the most important thing would be, what kind of activity have you been doing? Uh, since when had you had this injury? What kind of clinical complications have you had at this moment or do you have right now? That would be very important to decide whether which treatment would be better for you. But of course, there must be one treatment that can be good for you.
Absolutely. From my side, I will just add that when it comes to spinal cord injuries, we always evaluate each and every case. So we will need to see your spinal MRI scan and take a look at the images to really understand how the injury looks like, where is it located. We know that it's a C5, but it also we want to see how extensive it is and how many, what is the part of the neurons that are still intact. So all of this will play a role. Considering that you're a C5 injury patient, you are only 28 years old, so I think you still have the whole life ahead. So it's definitely worth it to consider a treatment, regenerative treatment and epidural stimulations. They both work a little bit different. If your injury is very recent, it's really advisable to start with regenerative medicine as soon as possible. But with epidural stimulation, it can give you additional edge where we can actually use a device, which is a programmable machine, to help activate your muscles, not only in the lower body, but also in the upper body. So if your spinal cord is still intact, even partially, you may be a good candidate for both of the treatments. And of course, with cervical injuries, the recovery is rather slow, but if you dedicate just 1 or few years of your life to the treatment and then to consistent rehabilitation, you can really regain a lot of independence in your life, such as the ability to stand up, but also to feed yourself, brush your teeth, or be able to drink your own water, brush your hair. So all of this is really, really life-changing. Not to mention all the autonomic complications that most patients like you have to deal with: blood pressure, temperature regulation, all of those things can be addressed. So I would recommend to you, Arif, to reach out to us and share your medical files with us, and one of our doctors will definitely spend time with you one-on-one, and we will discuss all the options as well as the long road to recovery, what will be required. It's the consultation is free, of course, so I really encourage you to try it. We have a question from Richard as well. Hi, Richard. You are waiting for your first consultation with one of our doctors, and you have a spinal fusion at T78. 4 years post-injury, you're suffering from extreme weakness and neuropathy from knees down. What do you see the treatment options that? What do you see as the treatment options that can help? You've done 4 stem cell treatments in the US already. From my side, I would just say definitely, if you are already waiting for your consultation, that means that we've seen your medical files, and that means that you are potentially a good candidate for one of our treatments. So go ahead with the doctor's consultation. If the doctors already have your case with them, I suspect since you already had your stem cell treatment, they will definitely recommend epidural stimulation. I see that you can walk. Okay, so probably we will stick to neurorehab and stem cell treatment. Dr. Beatriz, can you elaborate?
Yeah, of course. I completely agree with you, Hanna. What the epidural stimulator could do would be movement. So if Richard already has the capacity to move and step, that's not something that we won't we already do with the ES. So it would be very good to have a specific stem cell treatment. We have to find out what kind of stem cells he had in the past, what is the amount that he had, what was the way that he had these stem cells, and also what kind of PT has he done in the past. No, so that's very important for us in order to help him with the new regenerative medicine treatment.
Yes, definitely. I think, Richard, you did from your own stem cells. We are using actually stem cells from the donors, so you might see a difference in the treatment. In spinal cord injury, we really rely on intrathecal delivery method, simply because we have something in our body called blood-brain barrier. I see you mentioned that you only received your own fat stem cells as in a form of an IV. I think it's definitely worth it to try intrathecal delivery, simply because when we inject stem cells through an IV route, it really helps for the systemic regeneration. It can help with the overall to reduce the inflammation in the body. but those stem cells cannot really easily reach the central nervous system. This is why when we are focusing on, and I think this is due to the, since you are in the US, I think this is due to the regulations over there. But what we really like to do in cases like yours, we like to deliver them directly to the cerebral spinal fluid that is surrounding the brain and the spinal cord as well. So that means that, of course, this is not invasive. We inject at the level when the spinal cord is not there anymore, just into the fluid. So it can really help to deliver the stem cells directly where they are needed, which is in the spinal cord and fluid. I think the doctors will discuss with you during the consultation, but this is a big difference when it comes to delivery method and also the stem cell type.
Also, we use exosomes here in Mexico, which helps a lot. Which
Mhm.
exosomes work as carriers of the stem cells to the site of the injury.
Thank you. We have a question, Dr. Beatriz, maybe you can answer. If someone with spinal cord injury, but also with stage 4 lung cancer could benefit from the surgery?
Yes, we should. Obviously, we need to see an image, an MRI of the spine, and be able to see if there are any mets to the spinal cord that can unable to have this electrical circuit again. But yes, we can see this case.
Yes. I would say it also depends a lot on your overall
Condition.
condition. Keep in mind that with epidural stimulation, while the surgery is quite minimally invasive, it does require very extensive rehabilitation. So what we will need to assess is your ability to actually undergo extensive rehabilitation, because without this, we can only recover this much. So while in the clinic, usually patients coming to us for epidural stimulation, they either stay with us for 35 or 50 days, and they do exercise 4 to 6 hours every day. So I think we will really have to look at your case to understand if you are eligible candidate and if something can be done in your case. We also get a question about the treatment price. So it really varies. For the neurorehabilitation, I think the prices are quite standard. We always make sure that our patients come to us for an extensive program. So we always recommend the visit in the clinic to be really at least 20-25 hours a week to make the most out of this and to condition the body in the best possible way. And the cost of a weekly program really varies between $2,000 to $3,000. When it comes to the stem cell treatment, it also depends. I would say, depending on your condition and on your needs, it could vary from around $20,000 to $25,000, depending on the stem cell type and duration of the stay needed, as well as the delivery method. For epidural stimulation, that also includes the stem cell treatment, the price is around $110,000 for the 35 days of stay with us. So feel free to reach out, and we will see what kind of treatments would be recommended in your case, and definitely will our team will advise what's the best approach. We got a question about what stem cell type we would recommend for a T8, T9 injury level. Dr. Beatriz, allow me if I may. So it really depends. We look at, in between our clinics, we have access to different stem cell types and different regenerative products. So we have, of course, the mesenchymal stem cells from the Wharton's jelly. We have amniotic fluid stem cells from the amniotic fluid collected during the pregnancy, as well as the exosomes. So when we evaluate the patient, we really look at the patient's condition and things like spasticity and type of injury and so on. So it's really difficult to answer this without seeing your MRIs and seeing your case, but please reach out. We will schedule a consultation with our doctor and they will advise for the best course of action. In our clinics, we do have access to different stem cell types, and we actually switch and play around with different protocols depending on the patient's need. One more question we got is about our upcoming opening in Dubai. When are you opening in Dubai? We want to come over there. We are looking to really start treating patients end of February or early March. So if you would like to, if you are from there, from the Middle East, and you're looking to receive epidural stimulation, it will be possible to do it much, much closer to home. We will be housed in an amazing private hospital, Fakih University Hospital, that is also a university hospital at the same time, which is very renowned in Dubai. So we have amazing team of doctors, and we will be soon announcing everything, and more details will be coming online. But please feel free to reach out to us, and we will guide you through the process, evaluation process, and possible treatment. Just we don't have more questions as of now, but Dr. Beatriz, I would really like for you to maybe sum up what we've discussed about, especially with neurorehab in mind. Maybe you could tell us, how do you see the outlook for the future? What are you most excited looking at the future of neurorehab and neurorehabilitation? Are there any mobility aid devices that you feel can change a lot in the neurorehab, or would you still advise for the good old practical work with minimal assistance from outside? How do you see the future of neurorehab and how patients can continue to benefit from it?
Well, patients will always benefit from doing program sessions either at home that they learned in a clinic or a center, and also going to a clinic. As I told you, any kind of injury will always be beneficial to keep on moving. But nowadays, there are very high-end robotics. There is a great variety of robotics around the world right now. They have different characteristics regarding the weight that they carrying it requires. If you, depending on the neurological level that you have, depending on the capacity of movement, depending on the trunk control, and the aids that you could use, for example, a walker or maybe a pair of canes. Some of them are able to walk only inside a clinic. Also, others are for home use, and others are all territory, going up and down stairs. And obviously, this will be a very big change in the patient, because that will allow and enable patients to integrate completely in their everyday life and being independent. So
Thank you.
it's a big change for them.
Okay, thank you very much. And just to finish our session, if there is any message of encouragement from your side as an expert in neurorehab with so many years of experience and so many successfully treated patients, what would it be? What would you say to the patients?
This might sound a little bit repetitive, but really, movement is life. Really, that's very important. Movement will make you healthier bones, healthier respiratory system. You'll feel better. You'll have the ability and capacity of transferring, of moving by yourself whenever it's possible. No complications in your skin. And also, I always tell this in all of my patients in consultations. If you keep on moving, if you keep on yourself healthy all over, as soon as the cure for spinal cord injury, then I'm pretty sure that it will come around 10 to 12 years from now. You'll be in the best conditions to be able to take part of that treatment that will cure your spinal cord injury. If you haven't moved around, if you haven't done therapy, if you have many complications, those health problems won't allow you to take a cure.
Okay, I
So
agree
please
with you.
keep on
And
moving.
yeah, and all of this, really what we do, while, as we know, there is no cure for many neurological conditions and for spinal cord injury. What we offer at our clinics worldwide is really the closest that can get you to the best possible results and to reverse whatever damage has been done, but it's not a cure yet. But as long, like Dr. Beatriz said, as long as you keep your body moving and you keep your body and your bones, your muscles in the best condition, you really position yourself for success in the future. I think this is a very important message and a beautiful way to finish the live we had today. If any of you watching would like to connect with us and discuss your own program on how you can work on your condition, how can you get better, please by all means reach out to us. You can find our contact form on the website, and you can just message us on social media. We will be happy to talk to you and discuss everything. Even if you don't come with us, our consultations are free of cost, so we can help you to guide you towards recovery as much as we can. This is our mission. So thank you everyone for joining and for your time. Thank you, Dr. Beatriz, for this very insightful session. And we will probably see all of you viewers next month in another session with our doctors. Thank you.
Happy holidays. Bye-bye. Gracias.
Happy holidays. Thank you, everyone. Bye-bye. Bye, doctor.
Bye.